welcome for another session at the Finish Like project. And today's topic is something that just came up in my mind. One of the main problems that geriatric patients have as far as their oral cavity is concerned is loss of teeth or their decay. Now, as far as the complete loss of teeth in geriatric patients is concerned, that is edentulosum, I think it is very essential that this is something that we as orthodontists and the public health dentist can do together. Now, what I am proposing here is the idea of carrying out a dental census. Just as a census is carried out at a large level, by the government, if we can use all of our dental indices, that the DMF index or the Ferrier-Hotel index, and even the American College of Prosthodontics and Prosthodontic Index, if we can get them all into one place and carry out this large census, we can actually determine what is the exact cause on an average with the different values of deviations. We can determine what is the exact cause of edentulism. Now, why is it important to determine the exact cause of edentulism? Although this cause will differ and there will be multiple factors involved, but at least a large census on a large scale of different ages will help us determine that, this is the set of factors which is possible for edentulism. The most common factor that has come out already with different studies that have been done with population is the lack of care towards oral hygiene. Besides that, systemic factors such as diabetes, mellitus or other diseases have also contributed to edentulism. Now, as all as it may seem, edentulism is actually a big problem. How is it a big problem? Not only for the individual, but also somewhat for the population at large. Because whatever little potential is left of that person once he becomes edentulous, it sort of depreciates because of the reason that he is not able to get the kind of diet that is required for healthy living. For example, let me just give you one example. You have a person who is just become edentulous at the age of 65. So before he became edentulous, let us just suppose one more thing, that the cause of edentulism was severe periodontitis in both the maxilla and the mandible. Now that he's become edentulous, there's going to be a significant reduction of substances in his diet until he gets complete dentures and until he gets used to using those complete dentures. So the body is going to face that compromise of nutrients for that while, which he may not be able to function as effectively for his own self as he was included previously. Now, this sort of depreciation in nutrients, although again I say as little as it may seem, is actually has quite a significant effect on the family members. Because of the reason that they now have to take extra care of him because of the lack of instruments, he may develop other deficiency-related diseases or other deficiency-related issues. Alright, because the deficiency of diet is a huge issue if you look at it. I mean, if we are just to remove the basic vitamins from a person's diet, you can already see the kind of changes that come out into his body. More than that, in case the person is already suffering from some of the systemic ailments, this is only going to make things worse. So what is going to happen is that the person who was already suffering from systemic ailment is now going to end up with edentulism, and because he's going to end up with edentulism, what is going to happen next is the diet is going to get compromised, and once the diet gets compromised, the health overall gets compromised as well. For how long can one survive on tablets and medicines, right? So, the construction of a complete denture is something that should not be taken very casually. I have always treated it almost equal to or definitely next to orthodontic treatment. That is the skill with which you should, construct complete dentures. Treat it as if you were treating an orthodontic case. You should have all the records available, alright? Moreover, at the same time, since now this is going to be his main functioning part in the oral cavity, it's the duty of the dental surgeon, the prosthodontist, or whoever is operating on the patient or whoever is performing the procedure on the patient, that they should thoroughly read about that particular condition of the patient. For example, you have a patient with resolved ridges, highly resolved ridges, so you should go home and use your resources, the internet, and your textbooks to read about what is the exact technique of treating a patient with resolved ridges, rather than simply making impressions, sending them to the lab, doing some sort of, I would use the word jugaad, and in the end, give the patient that prosthesis. that is not going to work out in the long term. He's going to be happy for a month or two, and after that, he's not going to come and that will sort of deliver the prosthesis back to you, the one that you delivered to him in the first place, or her in the first place. All right, so this is one correction we can bring about, is that certain amount of seriousness as far as performing ISA complete dentures is concerned. Same applies for although in any procedure in dental surgery that we should take it up more seriously rather than perform it to the casual article that we've already done it so many times. We'll be able to do it again. Every case is different, trust me. Thank you so much for this episode of Finish I will be back with more information and more knowledge.